A well-known Minnesota treatment center is shaking things up. Hazelden Betty Ford is taking a new approach to helping more people recover from addiction. Here's why. The CDC says overdose rates are up 44% for black people and up 39% for Indigenous people. The data also shows that, in general, people of color are less likely to receive treatment. Susan Elizabeth Littlefield shows us how Hazelden is trying to change that.
It's a famous place. Hazelden Betty Ford is named after a first lady. It's a system stars praise for helping them face addiction. Addiction is something Ann Finnerty has known since she was young.
We smoked some weed, and cigarettes were not quite, long after that.
And you were how old?
12.
What did addiction take from you?
First and foremost, addiction took my ability to grow and know who I was, self-respect, integrity, all of my values that I live by today.
In her early 20s, she decided to reclaim herself. She started going to 12-step meetings where she found many who felt like her, but few who looked like her.
As a minority person, it was just kind of what we do. Like, we'll walk into a room and usually are the minority.
And at Hazelden, for many years, that's been the case.
Historically, yes, we've served primarily a white clientele.
That's why Andrew Williams, a cultural anthropologist, was hired.
Issues of economic inequality, lingering structural systemic racism, make our communities much more vulnerable because they really drive, hopelessness, despair, depression, and create adverse childhood experiences.
So Hazelden is starting new scholarship programs, partnering with Black and Indigenous recovery groups and widening their staff.
The research is really clear that when we can link up patients with professionals that share some common cultural groundings, that we see better outcomes.
One of those new clinicians is Ann. The proud mother to two is now a licensed counselor leading BIPOC groups.
We people in the BIPOC community just have a few extra layers. Generational trauma, cultural things that are happening right now.
And now there's a safe place to peel back those layers and move forward.
Everyone deserves recovery.
And Ann is proof. In Plymouth, Susan Elizabeth Littlefield, WCCO News.
Hazelden has also started a free virtual treatment program for Indigenous families.